Welcome Dr. Pedro A. Velasquez, president of LifeDoc Research, who's built an extensive career in research, particularly in the area of cardiac metabolism, centered obesity, diabetes, and related complications. Welcome, doctor. Good to have you with us.
Thank you both for it.
Thank you, sir. We're delighted to have you here.
Now, we know 7 in 10 Shelby Countyans are overweight, and then I think it's 1 in 3 adults have diabetes, yes, which is also one of the leading causes of death here in the county. So how does LifeDoc counter that kind of ingrained health issue?
First of all, when I came to Memphis, it was for something different,
Right.
totally unrelated to diabetes, okay? And in gratitude to what happened in my life, I choose to find out a way that I can actually help the community. And I find out that I was seeing kids having so much adult illness, having so much diabetes, that I didn't know anything. So I realized then that heart disease, diabetes are rooted in the community because obesity. If you take a look to the Shelby County brief report, you can see that the first most common prevalent conditions in Memphis are obesity related, 100%.
Right.
6 of every 10 deaths in Shelby County are diabetes, heart disease, and cancer related with obesity.
Wow.
Okay, so this is a disease that one of the challenges that we are facing is the fact that our adults are sick, our adolescents are sick. The next generation of Memphians is going to be sicker, and we've been taking a deeper look into the 6-year-old and the community. Guess what? I did a presentation for the Urban Child Institute in an internal meeting to raise the awareness, to call to action that we need to do something. Right. Our 6-year-old have 44% have obesity, overweight. Wow. About 59% have already elevated A1C. 37% have already a normal blood pressure. So this is something that it doesn't happen when you are 18. Right. Most of the continuity of life, most conditions go through the continuity of life. LifeDoc have developed an extensive database based mapping what are the most common conditions, what are areas of intervention. And I have to say that we've been lucky in developing some partnership with the University of Memphis, University of Tennessee, several of the insurance that have been interested in know what we can do.
Well, this is disturbing, but it's extremely important work. And you try to share with your clients and places like the Urban Child Institute that your lifetime of research on this subject shows losing a modest amount of weight and making some lifestyle changes, a little bit of physical activity on a regular basis can prevent or even delay type 2 diabetes, right?
And this is true. I mean, if you have a modest 5 to 10% body weight, you can delay. But remember that diabetes is multifactorial. By the end, the way that LifeDoc see that diabetes is not an independent disease. Diabetes is the consequence of a bigger disease that is called obesity. Obesity was recognized as a disease in 2013.
Right.
It wasn't a disease until too long, until they find out that the main cause of cardiovascular disease, hypertension, diabetes, cancer, Alzheimer, all of this is related with obesity. So we didn't have even prevented treatment not too long ago, okay? So I think that if we want to look the prevention of diabetes, we shouldn't be looking at diabetes. We shouldn't be looking at the pre-diabetes. We have to move a little bit more to the pre-disease condition. Right. Okay, I wrote an article in 2005 in one of the journals of the American ADA, American Diabetes Association, raising the awareness that we can predict what child is going to be obese, what child is going to be with diabetes, and what child is going to have heart disease as an adult, based in actual data. But our medical system is focused more in diagnosing than in prevention. Right. We need to say that this is a problem that is beyond LifeDoc. This is a problem that we need to involve Channel 5, that we need to involve industry, because it's the culture. It's the culture of our town. It's the culture of the healthcare system that we focus in diseases. That you are aware that the sicker you are, the more money I make.
Right.
Okay, so we need to change this paradigm. We need to change to see the healthier you are, I make more money. And this is what makes LifeDoc different. 10% of our growth income comes from quality metrics.
Wow.
Keeping people outside the hospital, keeping people healthier. There is a recent article, a recent study that was done by a Slingshot. Are you familiar with this?
Yes, I am.
Okay, a Slingshot impact study. This is the second year that LifeDoc get awarded, because for every dollar that LifeDoc spend, there is a return of investment in the community of $2.70.
Wow.
The 50% of these come from diabetes prevention, hypertension prevention, and obesity prevention. So this is something, we developed something based in Memphis and for Memphis. We developed a model that is a Memphis model. What we hope is that we can embrace as a community, refine, and be sure that we start to practice focusing the patient.
Well, in just our brief conversation before this interview, Dr. Velasquez revealed that he came to Memphis because of his son, who was a St. Jude patient, who is now well and running the LifeDoc company at 34 years of age.
He came outside.
Congratulations.
Thank you.
That.
Thank you to Memphis.
And so in total gratitude to the service you received here for your child, you have done all this incredible work that's saving the lives of Memphis children.
And I have to say that we focus on developing, mapping what we can do. At the beginning, no insurance paid for the service that we provide. Everything comes from our own pocket. This is our commitment. However, we won't be able to help many people if we don't develop a self-sustained model that any other physician can implement. Okay, this is where we move. This is how we've been developing. Our model of practice already in Tennessee have impacted more than 70 practice. And the model of practice that we develop is focusing on the patient. What does the patient need? And if you focus on the patient, for instance, for every 1,000 patients that LifeDoc is assigned, we produce $1 million saving.
Wow.
Wow.
Okay.
That's
Well, Doc,
amazing.
we'd love to talk more, but unfortunately we don't have the time today. But this man's expertise has come from Caracas, Venezuela, through Harvard, where he worked at the elbow of some of the leading investigators in this subject, and then to Memphis and the University of Tennessee, and then this incredible dedication that you've had at LifeDoc Health. Thank you for your service to our community, and we look to have another visit with you soon.
Thank you.
for coming in today.
Thank you. I
right.
hope to have you in LifeDoc.
Thank you very much.